Miss Josephine Mancho, thank you for giving me the opportunity to ask you a few questions. I've interviewed the medical director, the dentist, the nurse supervisor, and now I'm with you. About 5 years ago or more, when we opened the doors of Microhealth Medical Center, you were the administrator. At that point, I was very active, charting the course of the hospital, setting up the healthcare management systems, training you, of course. But since then, when I become disabled, I have withdrawn and used delegation as the model while giving feedback and all that. You have grown within the system, you've learned within the system. And when other health facilities close their doors, this hospital remained open throughout and still today. I would say it's a success story because of your leadership as the administrator. Tell me how you do it.
Microhealth Global Medical Center was launched in June 2016, yeah. And in November same year, a socio-political crisis started in the Anglophone region, beginning in the town of Bamenda and Boya, and that spread quickly to the entire Anglophone region by early 2017. Many health facilities around the vicinity could not function properly in 2017, with some closing their doors entirely and most having no doctor on sick.
You have managed the facility concurrently with teaching at the Catholic University in Bamenda. Also, you've been able to attend your PhD classes in economics. And yet, the hospital keeps progressing. And yet, the report coming back to me has been very positive. How do you do it?
It's not been a bed of roses. Managing a health facility, teaching, and I can say schooling has gone on concomitantly.
You are about to defend your thesis in economics. And we say your success in managing this facility has been because of you pursuing economics at the PhD level? Would you have been successful if you didn't have a background in economics, especially now that we have a lot of problems, the crisis, poverty, and all that? Can you explain to us whether your economics plays a very big role in your management strategy?
Yes, I can say yes. I began with no prior knowledge about the basics of healthcare, patient care, and disease. The basic economic principles of allocating scarce resources to competing uses aided me in managing the hospital. I've come to understand some of the basics of healthcare that has gone a long way to improve my management practice.
I'm very impressed with the way you interact with staff. I've seen it as I've been here for over a month, and that shows the leadership that I expect from you. How do you ensure that you are able to manage the situations between the staff and the patients and still keep me informed of the critical decisions?
Hold the bull by the horn. Since I was on the ground, that we call ground zero in conflict, I make sure I handle pertinent issues that can crumble the system with a lot of care. In cases that I need advice, I seek from the board.
Describe to me a situation that you have gone out of your way, almost losing your life, to save the life of a patient.
It's not been easy, really not been easy. Which one can I even recall? But there are several situations that I had to bypass gunshots to get patients from their homes to the facility. There are other times I had to carry patients that were referred for specialist care to specialist hospitals. And I can remember there was a patient, I think, in October 2019, that was in an altered state of consciousness. The diagnosis by the doctor indicated symptoms of kidney failure. And so the patient was referred to a specialist doctor some 90 kilometers away. Due to a 3-week shutdown as a result of the socio-political crisis and road blockages, the only way for the patient to reach a specialist doctor was for the hospital car to take him there. And it was much safer even for a female to drive. So I drove the patient myself. And I met road blockages. I had to take other difficult routes. And even on the way, I met men armed with guns, but they let me pass. They gave me a laissez-passer because I was carrying a critically ill patient, though the road had not been used for a couple of days. Unfortunately, after about 40 kilometers of travel, the patient died. It was such a horrible situation. And I had to carry the corpse back using the same road back to the mortuary. And when I took that decision to carry the patient to the specialist doctor, I actually prayed. I prayed to God. The patient situations could not hold me back. I told God, I know I'm risking my life to save life. Please take care of me. But if I lose my life in the course of doing so, then I was just serving you. Then you take care of my family. I have to go. Maybe God also heard my prayer that he died before reaching there, because it was really risky. The rest were 30 kilometers left. It was not a very good course. Thank God we came back alive, though the patient died.
For the patients and the community that are watching you, What message do you want to tell them?
To the Mbengwi community, I know you called Microhealth a reference hospital at the level of the community. Don't stay at home because there is no money to go to the hospital. Ask from those who have been using the facility. They will have a lot to testify that the facility offers low cost but high quality services. And in the worst scenario, at times we treat and discharge patients, and these patients paid their subsidized bills in little bits over a period of time.
General remarks that you want to, maybe I didn't cover.
It's been wonderful that the board thought of establishing this hospital with specialized equipment in a poverty-ridden community to ameliorate the health status of the community. All I can say is a big thank you for the financial support, especially for the first 2 years of operation. Actually, the board had contributed a lot towards us leaving our doors open, even when we were deep into crisis and had no hope of any cost recovery. So all I say, thank you so much.
Thank you very much, Josephine, for the work you do. The staff, the patients, the community, and even the monastery, the monks. As we face more challenges, there are going to be rough times ahead. The conflict, diseases, poverty, and even trying to make sure that we covered the patients that are in the bushes, the patients that are very poor, they have no means. So we have to put different strategies in place, and I count on you and the leadership, that is the medical director, the dentist, the assistant administrator, the head nurse, all of you to come together and make sound decisions. And then you can bring it up to me and say, this is what we've decided. And that I know has been happening, but as I come here, I'm pushing hard so that we provide help to this community. As we discuss, we're going to see how we can have a collaboration between us and the Cameroon Oncology Center in Douala. And we are already working on a strategic plan, as you know. And these are some of the things that we're going to make sure that we put in place before the end of this year. I thank you so much for your focus and zeroing in on the problems that we have. My door is open. You can come to me at any time. Thank you so much.